Hi, everyone. I'm Dr. Jolene Brighten. I'm a leading expert in post-birth control syndrome and a naturopathic physician. And today I am joined by Elaine, who's going to be sharing with us her journey with hormonal birth control. Thank you so much for joining me, Elaine. And I'm really excited to be chatting with you today.
Thank you for having me.
Well, let's begin this with how did you come to start hormonal birth control and what was that like for you?
So I started taking it when I was about 20 years old. But prior to that, I didn't start my period till I was about 15. And then I really only had periods like maybe once or twice a year. So then by the time I was 19, 20, I'm like, this is not normal. So of course I go to the doctor and, oh, well, let's just put you on birth control. Never once like, maybe we should do some blood work. Maybe we should see, like, is your thyroid okay? Is your endocrine system okay? I never once heard that. And I'm of an age group where I think that was just the norm. Like, let's just put you on birth control. It solves everything.
I think it's still the norm. It's still a lot of what we see. Yeah. And so
agree.
For you, you have irregular periods, which, that's something that it can take like a good decade for a woman's brain and ovaries to really establish that strong communication. But within a handful of years, you were put on hormonal birth control, which would give you an artificial period that your doctor could say, hey, we fixed your period. You're having it monthly, but we know it's not a real period. It's just a withdrawal bleed from hormonal birth control. And how did you feel when you started it?
Oh, I felt horrible. I was so nauseous for months. I remember months. I remember I would be driving in the car with my boyfriend and be like, could you pull over and stop? Like, I feel so nauseous. I just have to like get outside and like not be in a moving car. But I just put up with it. And then after about a year, I think that kind of subsided. So, yeah.
Yeah. And so, yeah, significant nausea is definitely something. We saw it with more of the earlier pills that were at higher dose of hormones, but it's definitely something that we see as well. It can affect all women the same, but that was definitely a sign your body was like, this is not for me. And so how long did you stay on hormonal birth control?
17 years.
17 years. And what finally made you decide that you were going to transition off?
So then the decision was, am I going to have a baby or not? And so I went off birth control when I was 37.
And how was that transition for you?
Honestly, it wasn't as bad as I, in my head, told myself, like, this is going to be horrifying in my head. And it really, like, I went off the pill. I got my period. I didn't have horrible cramps. I didn't bleed to death. And 3 months later, I got pregnant.
Awesome. And so are you having regular cycles now?
Well, now I'm 49. So, and I should say that, I ended up having a miscarriage. So I got pregnant, but I had a miscarriage.
Oh, okay.
Yeah. But now I'm coming into that stage of life where I'm starting to skip periods.
Yeah. Which is normal at, 49, the ovaries are like, we've done our time. So you got to ovulating right away when you stopped hormonal birth control, which is not the norm. Usually it takes years for women to get ovulation back. And then you became pregnant and you had a miscarriage. I'm super sorry to hear that, because that is something that is so heartbreaking when you're like, all I want to do is have a baby. And then I've had a miscarriage as well. And it's something where I'm like, there's no amount of words that ever brings comfort to a woman when that happens. So with that miscarriage, did they ever understand why that occurred?
No. And my doctor was like, okay, this happens. Don't worry about it. Go home and decide, do you want to have a baby? Do you want to try again? Wait a few months. And now in hindsight, looking back, because I should also say I went through Hashimoto's. So I pulled all the labs. I made her give me all my lab work from that time around the miscarriage. And so my TSH was up over 3.
Yeah.
So there's your answer. But I've realized that this doctor, well, I'm sure she's a lovely person. I always say she's a lovely person. I've learned over 20 years of being her patient, she's not a very good doctor. You know, she was always like, well, we could do a bunch of testing, but why bother?
Mm-hmm. Well, the thing about miscarriages too is that half the time we have no idea why they happen, but I think it always warrants investigation. At least that's my medical opinion. And you know, Hashimoto's is why I had a miscarriage as well. And so you reference TSH, and for women who are not familiar with that, that's a brain hormone that is basically your brain talking to your thyroid, and then your thyroid responds by secreting thyroid hormone. And there's been studies to show TSH over 2.5 is associated with an increased risk of miscarriage, as is elevation of TPO antibodies or thyroid peroxidase antibodies, which are more common in Hashimoto's. If you're going to get that diagnosis, that's the main antibody we're going to see. The problem is that so one is like decades ago, like even, you know, just gosh, about a decade ago, they still considered a TSH over 5 to be completely fine. And they keep flip-flopping on this where they're like, well, the TSH should be less than 2.5. And then they come back and they're like, it's probably fine. To me, I'm like, look, if there's evidence to show that if there's not adequate T4 to stimulate baby's brain, there's long-term studies showing like low T4, even if you carry to term, low T4 is associated with being behind both cognitively, so your mental capacity is behind as your child matures, along with motor skills. And they've compared this to cohorts of children up to 16 years of age, showing that if mama didn't have enough thyroid hormone, baby didn't develop properly, and it impacted their entire life. So to me, I'm like, don't mess around. It's a baby. Like, don't mess around. Now, did you end up getting that dialed in with your thyroid? We see it's super common to be on hormonal birth control and develop a thyroid condition. Did you end up getting that dialed in?
So finally, let's see, I had the miscarriage when I was 37. And then around age 44, I gained 10 pounds in 3 months. I was dragging myself around. I was so exhausted. My hair was falling out. It was breaking. I mean, I felt like I jumped off a cliff. I just felt horrible. So again, I didn't really have an internist. I go to my gynecologist and she's like rolling her eyes at me. And she says, well, this is just part of being in your mid-40s. And I was like, oh no. No. So me, I'm such a I've done all my reading, and Sarah Gottfried's books have been really helpful. So I go in there with my whole list of these are all the tests. And again, the eye rolling. And she's like, okay, but I refuse to test you for antibodies to your thyroid. So
that makes no sense. If you're living in the United States, it's the #1 cause of thyroid disease. Well, what I'll say though, is that from her perspective, in conventional perspective, they're like, whether you have antibodies or you don't, we're going to treat you exactly the same. It's not going to make a difference. Whereas from a naturopathic or functional medicine perspective, our perspective is if you've got antibodies, then we have to treat the autoimmunity. And we know that the average woman, by the time she gets the diagnosis of Hashimoto's, actually has a total of 3 autoimmune diseases. Because once you lose tolerance to yourself, that is, once your immune system starts attacking your own tissues, it's just a matter of having the genes to start developing more altogether. So it's very, and that's the thing too. Are you looking for root cause? Because they can give you Synthroid, which is synthetic T4 all day, every day. But if it is actually a selenium or iodine or vitamin A deficiency, that has to be treated as well. And that's why so many people don't do well on Synthroid, because they're it's so short-sighted in terms of the approach.
Yeah. So my TSH was over 8, and no wonder I was dragging myself around. And then I finally went to a naturopath, and she's like, well, we got to test your antibodies. And so they were over 1100. I was horribly anemic. She was like, we got to address all of this, vitamin D deficient, B vitamins, all of it. I mean, I was just a mess. So they put me on the Synthroid, and I immediately felt better. But then 6 weeks later, I developed psoriasis from my scalp to my ankles. And I go into this, I live in LA, so I go to UCLA, the fanciest, medical dermatologist. I roll in there and he's like, oh, that's guttate psoriasis, which typically is in teenagers. It typically comes on with an infection, like a bacterial infection. I didn't have that. So then he says to me, well, I think this is going to go into lupus. And I'm like, oh my gosh, what is wrong with me? So I go home and I thought, no, I'm not going to be on medication. He wanted me to go do, basically, I call it the medical tanning bed. Have you heard of it?
Oh, yeah.
Which is $250 a pop, and I have the fairest skin. I did it once after I signed the 12-page release saying I wouldn't sue them when I get skin cancer.
Yeah. And so for people who don't know what that is, it's actually UV light exposure, which has been shown to be really beneficial with psoriasis. Interestingly enough, though, you said something in your story, which was having low vitamin D, which can be a trigger for developing other autoimmune diseases. And, you know, there's something very unique in your history, which is almost, it's not that unique in terms of my patient population. And that is, I see the majority of women who develop autoimmune disease and then go on to develop more and more, have a history of hormonal birth control use. And as long as you were on that pill, it was causing intestinal hyperpermeability. So if we talk about how do you get autoimmune disease, one, you have to have the genes, although there's starting to be research that says you don't have to have the genes because environmental toxins can trigger all that for you. And then you have to have intestinal hyperpermeability, or what's called leaky gut. And birth control absolutely causes that. And that can lead to food sensitivities and gut dysbiosis. And then you have to have a triggering event. And interestingly, there have been studies that show that birth control itself can be a triggering event for things like Crohn's disease. And so that's, you take an oral contraceptive and then you can develop Crohn's disease within a 5-year period if you have that family history. And so if we know that to be true, that's a disease that's rooted in the gut, then really, I mean, any autoimmune disease is on the table. So birth control itself can be a triggering event. It causes, it actually skews the microbiota. It kills off the good stuff. So bacterial, viral, parasite, these other proteins coming through, that could be the triggering event as well. And, you know, what you're describing is what we see with hormonal birth control. Sometimes women develop, because the way hormonal birth control works, it actually will grab on to it causes proteins specifically to grab onto your free thyroid hormone. It depletes nutrients your thyroid needs to actually function. And then because you're inflamed and you're just on the only synthetic hormones, you don't actually use your thyroid hormone at the receptor level. But often I'll find women go off of hormonal birth control, and in that post-birth control syndrome phase can actually trigger other autoimmune diseases. And that's not to say that you should stay on hormonal birth control for anyone listening, but it's that whole connection of why do women get autoimmune diseases at a higher rate than men? It's because of that hormonal component. And so if you give the pill, you can, or any other hormonal birth control, you can trigger autoimmune disease. If you take it away and that woman hasn't been supported in that, you can trigger autoimmune disease. So you had Hashimoto's already. So the TPO antibodies, it's autoimmune thyroiditis that causes hypothyroidism for people who don't know what that is.
Right.
You had psoriasis, which also, you know, psoriasis can lead to joint changes. I mean, people are always like, oh, it's just your skin. One, it's your skin and everybody can see it. And two, psoriasis can go so much deeper than just the skin. So you opted not, you did one session of the UV, basically they're like tanning beds. But
it's like a stand-up tanning bed is what it is.
Totally. Yeah. And so you did one round of that. Now I'm looking at you and you do not have, you don't have psoriasis head to toe. And for people who are listening too, I want women to understand, we see psoriasis, eczema, acne, weird rashes that like the dermatologist, like, I don't know what this is. Totally part of post-birth control syndrome, like come up. And it's because that's another way of your body expressing big time internal issues.
Right. Yeah. So I just was like, there's gotta be a different way. There's gotta be a better way. So I went home and started reading, and I found Isabella Wentz. I found her book and Sarah Gottfried. And I just started reading anything I could find. And what I consistently read was changing your diet. Well, I had been vegan. And part of why I had been vegan was I had so many food issues and digestion issues. So I went from being vegetarian, which I started right around the time that I went on birth control, because I was already having the digestive issues, but not realizing it was part of the birth control. Yeah. And so over the course of those 17 years, was vegetarian, and then ultimately went into being vegan. And everything I was reading was, oh no, you got to try autoimmune paleo. So being vegan, all those grains and beans and lots of raw veggies.
Yeah. And not to mention that the birth control pill is depleting B12, and B12 is important for energy. It's part of our nervous system, our myelin sheath. It's how your mitochondria function. Like, it's involved in so many things within the body. And so that's something that, like, women who are on a vegan or vegetarian diet and on hormonal birth control, it's like, if you're already on a diet that is, devoid of some of the key nutrients you need, and then you're on a medication that depletes it, you need support. And that's not to say that vegan or vegetarianism is bad. It works for some women, but they have to understand that, like, you can't go eating all the, I was a vegetarian for 10 years, and I was like, I get my B12 from tempeh. And then I'm like, oh, how much soy did I consume? My goodness.
Oh,
and
yeah.
Gut. I mean, soy is one of the top allergens. That is a way to fast track. I mean, I was on birth control, and I'm like, no wonder I can't tolerate soy. I ate copious amounts of soy every day. And I ate egg whites and soy because I thought fat was bad back then. Oh my God, I rolled.
Oh my God.
And I was on hormonal birth control. And then I developed food sensitivities to eggs and soy. And I was in that same boat. Like, I remember at one point, I did a food sensitivity test. It was a 96 well test. And there was like a handful of foods I could eat because I was reacting to everything. And my doctor's like, you have to cut it all out. At the time, I didn't put together that I was on birth control pill. And that, like, only now I know from all the research I've done that I'm like, I had leaky gut. I had all these food sensitivities, and the root cause wasn't stop eating all these foods or eat all the glutamine I can. The root cause was get that pill out because it's an obstacle to healing, and do something different. And it was only like me being bitter sitting in medical school that, like, I'd been popping a pill every day and then learning, I'm only fertile 5 to 6 days out of the month. And that's only because sperm lives that long. And then I was like, why didn't anyone ever tell me that before?
Oh, I know. That's why I wish my younger self, I could go back to my younger self, because what we know now versus what I know, it's like, it boggles my mind. And I think with all the autoimmunity, I've had to retrace my steps.
Totally.
Like a lot of antibiotics as a kid because I had a lot of strep throat. It's like it all makes sense, right? Hindsight is 2020. But yeah, I mean, I was on this vegan diet that for me was not doing me any favors. So the minute I got off the gluten, I'd already gotten off dairy, but got rid of the grains. I had not eaten meat, chicken, or fish in 25 years. I started with fish. And once I started changing up my diet, adding some supplements, adding collagen, it was like transformative. And so all those, I mean, it looked like I had big chicken pox literally all over my entire body, to the point the guy that I was with at the time was like, he was freaking out. He's like, I'm afraid this is going to scar your skin. You're so fair. And I just remember being in such total despair, but changing my diet within 6 months, my numbers had totally come back into line. I only took the levothyroxine for 6 weeks because when I broke out in the psoriasis, they were like, well, we don't know if it's some sort of binder in the drug. So that was the other crazy thing. I went and dropped $1,000 with an allergist who basically said, you're allergic to everything.
Yeah.
You're allergic to so many foods. I've never seen anybody, but that's a skin prick test. And I don't know how much
Well, and it's also that, like, your skin was also inflamed. Your immune system was hot and bothered. So that's the other thing, is that when you're autoimmune, so hormonal birth control, we talk about the autoimmunity, but it's also highly inflammatory. And this is part of post-birth control syndrome, is that if you don't do the work to really heal and really, rehabilitate the body from the damage that's done, that's where we can see the progression of other symptoms coming up. A big thing that you said you did, though, is cutting out gluten. And so for women who are watching this, gluten actually contains a protein called gliadin, and that protein looks enough like your skin and enough like your thyroid that if you ingest it and you've got those antibodies can basically get confused and your immune system gets confused. And so every time you eat gluten, your immune system's like, let's attack our thyroid, let's attack our, you know, our skin, like whatever, you know, whatever it's seeing. But in addition to that, like I've seen so many times clinically that you can, if you're eating gluten and you have you don't have to be allergic, but having a sensitivity to it, you don't even have to have autoimmunity, is that you'll find that you can get welts easily on your skin. So these people will actually draw a line and they'll get welts on their skin. And my husband actually went through this, and we one time drew on his back with our nails, my sister and I, like where we were like, look at like what you can do. This is like when I was in medical school.
Wow.
And I was like, this is gluten. This is what I'm learning, is that this is gluten. And so that's something where it can make it really confusing when you go to an allergist, because if I just drew a line with your with my fingernail on your skin, it could cause a welt and cause you to react. And so, you know, doing a skin prick, maybe it was true, maybe it wasn't, maybe you were just in the heightened state of being inflamed at that time. But, you know, that's so for people who don't understand, what you would have been handed next with having that, so you're like, I don't want to do the UV beds and autoimmune diseases progressing, is you would have been handed some really significant drugs that could lead to cancer because they are so immunosuppressive with that. But you didn't go down that route. You changed your diet, and in 6 months you were able, you were not on thyroid medication, your skin, you were able to clear your skin and heal it naturally. And so much of it was coming down to the gut and what that birth control pill had, you know, it contributed to within your gut as well.
Oh yeah. And I think I was like you, being vegetarian. I ate so much soy. I ate soy everything. And this was like, you know, in the 90s.
Oh yeah.
When all the GMO.
And we eat all the soy because soy's so good for you, and all the grains. Yeah, I destroyed my body with that too.
Oh yeah. All the fat-free food and Snackwells. Is that company still in business? I mean, those fat-free cookies that were just like a sugar bomb. Like I lived on sugar. I lived on pasta. I went to UC Santa Barbara where everything was Mexican food. I mean, my Lord, when I think of what I used to eat, just horrifying.
Man, when I started the birth control pill, and I share this, I was driving through fast food windows being like, oh, I can eat McDonald's, I can eat Taco Bell, like whatever, like wherever I was. And man, nobody told me, hey, hold up, slow your roll with that. You're on a medication that's depleting nutrients, and then you're fueling your body with things that are nutrient void. And then I flipped. I was like eating fast food, and then I was like, I'm a vegetarian. I eat zero fat, and like, and I ate. I mean, as a vegetarian, I ate like 8 cups of vegetables every day. So thank goodness for that. But when I look back, and I'm like, whoa, and it's just like you said, like hindsight is 20/20, and which is why it does us no good to, like, you know, be judging ourselves for what we would have done. Nobody should judge themselves, but, you know, in general, but certainly not before your brain develops, which is about age 25. So we all have to give ourselves a break at that point.
Oh my gosh. But I'm of an age group where, I mean, I can remember my doctor saying, this is good for you. Birth control is good for you. You won't get ovarian cancer, you know, so you need to take it. It's as though it was a missing element of your body. I mean, it was just insane.
Well, what's interesting is that at the same time they were selling us a fat-free diet, and again, I totally did that. I like when I go back now and I'm like, oh, all those egg yolks I wasted, that was so good. Or I convinced myself I hated butter. That's a lie. Nobody hates butter. Like, nobody hates butter. I was like, I hate butter. That's what I would tell people. I'm like, you were crazy. You were just a crazy lady. So, but with that, at that same time, that's when we saw the marketing really ramp up with telling women that birth control could, you know, cure everything ailment that you have. And doctors were being educated that this is the best way to prevent cancer. I remember my doctor saying to me, like, if you don't want to get, ovarian cancer, then you need to take this birth control pill. I remember hearing that, and I'm like, well, never mind, like the breast cancer, cervical cancer, liver cancer, like these other cancers. And now being a doctor, I'm like, there are a lot of better ways to prevent cancer than shutting down your reproductive system.
You think? Yeah. No, and even now, here I am 49 years old and go to my doctor, and she's like, because I was having just perimenopause symptoms, like kind of bleeding during sex sometimes. And she's like, well, let's just put you on the pill. And I just looked at her like, are we starting that again?
Mm-hmm.
Like, I'm 49.
What's disturbing about that is that once we get over age 35, that's when the risk of like heart attack and stroke really go up for us. And, I've had women in my medical practice who were put on the pill for perimenopause, and their doctor said to them, when your period stops, that's when you'll discontinue. And here they are, 55, 58. And they're like, my doctor doesn't know what to do because I'm still having my period. I'm like, you're not. You're having a withdrawal bleed from a medication. That's you haven't had a period. So the day we start that pill, our periods stop. It's all medication withdrawal. And that's where we get in this really dangerous slippery slope. And then what else raises our risk of breast cancer? Now, granted, the studies show that there is a moderate risk, about 13 out of 100 cases, more cases every year of breast cancer. To me, I'm like, it's cancer, okay? So like a moderate risk is a risk, and women need to know on it. But what puts us at greater risk for breast cancer is the longer we're exposed to estrogen in our life. And there's a lot of experts out there who state that, what happens is that we're all developing breast cancer cells. Then we go through menopause and the estrogen stimulation drops. And so now the immune system handles the cells don't develop. And that's why like bioidentical hormones, people get concerned about those. But what's crazy to me is how many medical doctors I've conversed with that like hate on me for giving bioidenticals. They're like, you're giving a topical bioidentical. Those things are so dangerous. I'm like, you're giving a pill, you're giving a birth control pill, which is not bioidentical, it's totally synthetic, and it's oral, which means it has to be a higher dose, and it's harder on your liver in the long run. And when it comes to your metabolism and really living, like your liver is everything. Like it's everything in that.
It's so true. It's so true. I tell younger women all the time, you're making a big mistake. Don't take it. Don't take it. I know it's convenient. I found it super convenient. But if I could go back in time, I wouldn't take it, because I think it's the root of a lot of the health struggles that I've been through in the last 5 years. So, and I always say, I don't wish autoimmunity on anyone.
Oh, no. And it's definitely something I developed. I developed postpartum thyroiditis. So after I had my son, that was the triggering event for me to develop autoimmune disease. Although I definitely wonder, what did that decade on the pill do to like really set me up for that further? And, for women or anyone who's never had autoimmune disease, like it's a hard thing to grasp that for you had psoriasis, so you didn't look fine. But for most of us, we look totally fine. We might be overweight. I mean, I went from, I lost like my pregnancy weight because I started out hyperthyroid. And then by, 1 year postpartum, I couldn't fit in my third trimester clothes. I gained so much weight. And so physically speaking, people were like, oh, well, you're a new mom and you're overweight. And, I remember people even being like, oh, you're just a chunky mom. It's okay. But I was so fatigued. I was in so much pain. I was so depressed. Like, and what was crazy to me is I remember the first day I took my thyroid medication, like brain fog gone, joint pain gone, finally was happy. And I remember sitting in my kitchen and being like, I love my life. I have a really successful practice. I have this great kid. I have this great husband. Like I just could list off all of these wonderful things. I'm like, why don't I feel happy? And people would say that to me, like, oh, you have everything. Why don't you feel happy? Well, because without thyroid medication, one, your mitochondria get really upset about that. And if they're upset, like you're going to be in big trouble with energy production and with mood, but it starts to affect your serotonin production. So you can't actually create it. You can't actually use it. And it starts messing with all of your neurotransmitters. And so no matter how good externally everything seems, or, how much you're like working with a counselor or doing all of this, mindfulness practice, all these things, like if you're deficient in that hormone, or you've got autoimmunity, which is inflammatory and causes disruption in the brain, like you're going to have these kinds of symptoms. These mood symptoms are definitely a part of that. But I bring up that mood piece because it's another thing that a lot of autoimmune patients struggle with and doesn't get recognized enough.
Oh, for sure. I mean, I'm generally a good-natured, happy person. And, I was teaching Pilates full time. And I thought, I'm supposed to be this picture of health. And I literally would sleep 10 hours a night and drag myself out of bed. And it was all I can remember, just teaching class and being so brain fogged and thinking, just get me may I just get through this hour? And it was all I could do to just come home and lie down on my couch. And I was so depressed and didn't want to go out, didn't want to do anything. And I did not exercise for 6 months because I had zero energy at all.
Well, and it's zero energy, plus without adequate thyroid hormone, your cells cannot repair themselves. And so this is why, hand pain, foot pain, joint pain, so common in Hashimoto's, is because if you don't have thyroid hormone, then you never repair those tissues. And, for people who are watching this, Pilates in particular is very hard for brain fog because you are moving your body. I used to be a Pilates instructor as well. But you're moving. I worked my way through college as a group fitness instructor, but you're moving your body and you're moving your arms and your legs in a certain sequence. And it actually really depends on your corpus callosum, so that how your brain, the both lobes actually connect, really being able to connect and all of that. And then for anyone who's like a group fitness instructor that's listening to this, they're going to know you have to memorize a lot of the routines. You have to stay on count. You have to it is like multitasking 3,000. So whenever people are like, studies are like, oh, you can't multitask, I'm like, talk to a group fitness instructor, because you are counting beats. You are like, paying attention to the number of movements you've done. You're paying attention to people's form, to your form. Like there's so much going on. And so that's I'm impressed that you were even able to do that with brain fog.
Well, I always say it's like half of my brain has to keep track of like all the people in the room. And the other half is like in my head creating the class as I'm going forward. I mean, I've taught Pilates for 12 years, but I felt like a hot mess. Like I was not living the instructor life. That's for sure.
Totally. So I'm curious, we connected on Instagram. How did you come across my work?
I know somebody told me about you and I can't remember who it was. And so I looked you up and first of all, I love all your posts. They're beautiful.
Thank you.
But I love just your whole approach and the information that you're giving. And I always think to myself, God, I wish I knew this woman when I was 20, because
I wish I knew this woman when I was 20.
Right? Because I mean, there's just so much more information out now than there used to be.
Yeah.
And, I just love the message that you send. I think you're funny. I crack up.
Good.
And I like your Insta stories. I love how you talk about the little human and what you feed him and stuff. So I pass you along, especially as I come across these 20-somethings that love their birth control. I'm like, no, you have to go look up this woman. Just follow her. Just listen to what she says. So
yeah, well, that's really what we need. Is we need a community of women supporting women wherever they're at on their journey. And especially, women like you who are like, this, I've lived this, like learn from me and don't make the same mistakes. Like, I think it's really powerful that you're sharing your story with, future generations of women. So for women right now who are, so you've already said like, don't do it, don't take it. But if they're on hormonal birth control right now and they're feeling fearful about transitioning off or stopping it, is there anything you would want to share with them?
I think here's a perfect example. So I go get my nails done and my manicurist saw me dragging myself in to get my nails done years ago. So she has seen the process from the psoriasis to all of it. So she said to a client of hers, hey, who has Hashimoto? She says, hey, this other client, like, you should really listen to her. She has healed her Hashimoto's, and this woman wants no part of it. She wants her medication. And so I met her and we started chatting and I said, let me just ask, are you on birth control? Oh yeah, because I have fibroids and I have to be on it. And I said, you might just want to do a little reading. You might just, I know you trust your doctor, but just do a little reading. Food won't do anything. And I think the key is always be open-minded. Always seek out other information. There might be another way. And I'm a big believer that, food can be transformative. I mean, so much so that I manufacture a collagen beverage, right? I don't know anything about the beverage business, but I started a beverage based on collagen because I'm such a big believer in it. So I think trust your instinct, especially I've had doctors say flat out, say to me, food doesn't matter and changing your diet won't do anything. I never went back to that endocrinologist because had I listened to her, I think I'd still be sick and feeling bad.
Yeah.
So, you know, I think as women, it's sometimes something we forget, but your intuition is your greatest superpower. It's your greatest gift in life, whether it's your health or who you're dating or your job or whatever. Trust your intuition for sure.
Well said. I think it's the biggest trick that's ever been played on women is telling them that everything is in their head and that little voice is not worth listening to. And women are waking up, and it is an incredible time to be a woman.
Yes.
So many women are waking up and they're like, wait a minute, I'm going to listen to that little voice. And I have seen so many women that are like, you know, I had this sneaking suspicion that birth control wasn't working for me. I went to my doctor. They were like, no, none of that could be possible. Right. I went off and everything changed. And, you know, that's actually how I went on to study nutrition, is that as a kid, I was diagnosed and treated for H. pylori and then told I'd be on proton pump inhibitors for the rest of my life at like 7
Oh my God.
Yeah, back then, these things were not over the counter and they were never tested on children. And they gave them to me and I was disconnected from my body. Like it was weird. Like I couldn't figure out how to get home driving a car some days. Like the brain did not work. And that's when I was like, but wait a minute. I only have heartburn if I like drink orange juice and have refined carbs. And like I started to put these things together. And my doctor, he was like, it will never matter. You can make all the dietary changes you want and it will never matter. You will always have heartburn. And that's when I was like, just my personality is I'm like, oh, really? I'm going to prove you wrong. And then that's when I started studying nutrition. And I was like, I need to get a degree in nutrition because there's something to this. And when you're studying nutrition, like you went to Santa Barbara, I went to Cal Poly SLO, so also on the Central Coast. And, you know, that was when they were like, oh, if there's a, you know, patient that has X, Y, and Z, then these are the foods that you use for that. And like, it was such a great education to be like, wow, this was literally teaching me how to use food as medicine. And I'm like, wait a minute, if this is what like they recommend in the conventional paradigm, like why are doctors not listening to dietitians? Like, why is this something that's being ignored?
Yeah, no, I agree. And, you know, even my mom has autoimmunity. She has microscopic colitis. She's 88 years old. She's really struggling badly with it. And she lives in a retirement community where she eats in the dining room. I cannot get them to be transparent about what's in their food because I think they don't want me to know how bad the food is.
Oh, man.
And it's so shocking to me. You know, I always say I live in this bubble with all these women that we're all into health and wellness and eating well to take care of our health as well as beauty and everything else. We're a little small bubble. And most of the world does not live like that. And it's shocking.
Yeah. No, I live in Portland, Oregon. It's a huge city bubble. Like, and my husband and I were just talking about that, about like, wow, how could we live anywhere else? Like I have autoimmunity. He has a family history of autoimmunity. We can't be eating gluten. And we're like, you know, we live in like a mecca for food sensitivities, we've got more healers per capita than any other city, but it's a total bubble. And this is the thing. This is why we're doing these stories, is because not everybody understands these connections. And it's when we hear other people's stories that we really wake up to what's possible and have an understanding that like it is possible to heal your body naturally and to work with it instead of working against it.
Yes, for sure. I mean, even my own brother, he's got horrible allergy sinus stuff, which I had when I was vegan. Again, it's all that gluten and grains. I was like, just 7 days, get off the gluten, the grains, the dairy, and all that sinusitis will stop. No.
Yeah. No. Well, food is very hard for some people to give up. My husband had severe migraines, like debilitating migraines. And I was like, that's gluten. And he didn't want to give up being a beer drinker. And then finally he had a migraine that was like a week long. And he was like, this came on after I had 3 beers. I'm like, what do you think about that? No, he stopped gluten, no migraines since. I'm like, there's something to that. But he I think he probably knew for like a good year and a half that it was like, yes, it's this, but he was not ready to go there. And that's the thing we have to recognize, is that we're all at different stages, and some of us will get there eventually, and some of us will never get there in this lifetime, because that's not really what we're here for. We're here having a different kind of experience. And so to me, I'm like, it's never worth judging the process, because how do I know someone else's life and what they're supposed to be doing like better than themselves?
Yeah. And I mean, again, having been a Pilates instructor for so long, I always, in my head, I say, just meet people where they are, and people ask me all the time, all my ladies know what I've been through, and I tell them, this is what I do, but that may not be right for you. Or maybe this isn't the right time for you, but go read up, go do your own exploration. On my website, I have a whole resource of, these are the books I read that helped me. Go seek information, and don't just blindly trust doctors. Because even I've been to some of the best doctors, and the one who said to me, well, I came in with all my books and they were all highlighted and this and that. And she's like, there's no science to that. If it makes you feel better here to not eat gluten, then go ahead and do that. But it's not going to do anything for you.
Yeah, except there is lots of science, especially with psoriasis. Psoriasis has been well recognized. The gluten connection has been well recognized for decades, like way before Hashimoto's, way before anything else. And if you go on to medical databases, they will state that the gluten, the gliadin protein, can be a trigger for Hashimoto. So it's just a matter of this is the other reason why we're doing these stories, and is waking up doctors as well, because they only know what they're getting educated on. Like as a doctor, I spend a lot of time on PubMed and reading things and exploring other things, because otherwise I don't want my knowledge to be limited by what my continuing medical education will teach me. And that's what happens a lot, is a lot of doctors, they only have time to go do their CMEs, that's what they're called, and they're not getting the full picture of what's happening. And I think that doctors, I learn the most from my patients, and it's always something where I'm like, people will bring me in stuff and I'll be like, well, I've never read research on it. I've never seen it happen, but if you're saying it happened for you, let's keep documenting it, and let's try to understand why that is and why that's true for you. Right. So for women who are watching this, they want to learn more about you, they want to follow your journey, where can they find you?
I'm on Instagram at drinkeviva, and I have a website, drinkeviva.com.
Can you spell that for us?
Yes. So drink, D-R-I-N-K, Eviva, E-V-I-V-A.
And that's the collagen drink, correct?
Yes.
And what else is in there?
So I tried to make as clean a product as possible. It's a water base, and it's flavored with extracts and essences and a little bit of monk fruit. And then it's got marine collagen, which is 5 grams of that. That's good for skin hydration, and 2 grams of avian, which is chicken collagen. That's good for joint health. So 7 grams of collagen, 35 calories, no sugar.
Fantastic. Yeah. Well, thank you again. I really appreciate taking the time to chat with me and share your story.
Thank you so much. Thank you for all the work you do to help women with their health. It's amazing. And I'm ready for you to tackle perimenopause and menopause, because that's where I am, and I need your help.
I know. I need to put out more information about that. Yes. Yeah. So look for more around that. Well, awesome. Yeah. Well, I hope you have a fantastic day. And again, it's such a pleasure chatting with you.
Such a pleasure. Thank you so much.